So what brings you in today?
I have been getting a lot of infections and I bruise easily and I have swollen lymph nodes, I think.
Well, let me check your lymph nodes and see how swollen they are.
Okay.
Okay, well let me run some tests and I'll be back in a couple minutes.
Okay.
Well, based on your results, you have an abnormal elevated white blood cell count, which means you have acute Hodgkin lymphoma, which is a form of leukemia.
Am I gonna die?
Well, with proper treatment and chemotherapy, you can actually go into remission. So if you start that right away, you will be on the right path.
In leukemia, bone marrow rapidly makes abnormal white blood cells that don't function properly. They don't die when they should, and they crowd out other important factors in the blood. Acute Hodgkin lymphoma comes on quickly and targets the lymphatic system. Leukemia is dangerous because it comes on quickly and it can be fatal in just a few months. The slide shows how numerous white blood cells are in the blood of a leukemia patient versus a healthy individual's blood smear who would probably only have just a few white blood cells.
So what brings you in today?
Well, I've been having headaches and dizziness, and I feel fatigued all the time, and then I crave ice.
Okay, well, that's actually a symptom called pica, which basically means that you just crave non-food objects. It sounds to me like you might have anemia, but I'm going to do some blood tests. So I got your results back, and you do have low levels of ferritin, which indicates that you have iron deficiency anemia. I'm going to put you on some iron pills, and you just need to stick to a healthy, well-balanced diet, and that should help.
Anemia is a condition where the body doesn't have enough healthy red blood cells. There are two main types of anemia: sickle cell and iron deficiency. Sickle cell anemia occurs when the red blood cells have not developed properly and do not have the typical biconcave disc shape. Iron deficiency anemia can either indicate blood loss or red blood cells that are not working properly. You can see in the slide how the red blood cells are dull and lack the rich red color that a typical red blood cell would have. So what brings you in today?
Well, I have a lot of bruising and bleeding, and I also have night sweats, and I've experienced a lot of weight loss.
I'm going to go ahead and do some blood tests, and we'll look at your white blood cells.
Okay.
So we looked at your white blood cell count, and it's abnormally high, which could lead to leukocytosis.
Okay.
So it's not a big deal. It just means you have bacterial or viral infection. So we're going to go ahead and give you some IV fluids. We're going to do leukapheresis, and after that, you should go back to normal without any more treatment.
Okay, awesome.
Leukocytosis is an abnormally high white blood cell count. It may indicate a bacterial or viral infection. As you see in the slides, there is an abnormally high number of white blood cells. Leukapheresis is a procedure to decrease the number of white blood cells. Blood is taken from your body through an IV, and your blood is usually sent to a lab for further testing.
So what brings you in today?
Well, I've experienced a lot of headaches, dizziness, and shortness of breath.
Okay, well what we're going to do is we're going to take a little blood just to see what's going on there, okay? So our diagnosis is that you have polycythemia vera. It's a bone marrow disease, and it can lead to an abnormal increase in your number of red blood cells. So what we're going to do is we're going to try to thin out your blood, and we're just going to take a pint of blood each week until your red blood cell count drops. And then you should be good to go and back to normal.
Polycythemia is a disease in which red blood cells are increased due to either two conditions: polycythemia vera or secondary polycythemia. Polycythemia vera is an increased number of red blood cells due to an abnormality of the bone marrow. Secondary polycythemia is an increased number of red blood cells caused by high altitudes where oxygen levels are lower. As you can see in the slide, there is an abnormally high number of red blood cells, which increases the viscosity or thickness of the blood.